Hi, this is case of empty nose syndrome, and I am using platelet-rich plasma to infiltrate in nasal cavity at multiple sites as a stem cell therapy as well as plasma expander of the nasal cavity. And you can see there is absent of middle turbinate completely and partial absent of the inferior turbinate in this picture. And this patient come with nasal obstruction even though adequate nasal cavity or wide enough. So in empty nose syndrome there is paradoxical obstruction of nose even though large cavity. First time the term empty nose syndrome is given in 1994 by scientists E. Kern and M. Stenvist in 1994. And this is mainly because of surgical resection of inferior and middle turbinate mainly. And empty nose syndrome is divided at least in four subtypes. Empty nose syndrome because of inferior turbinate, one type. Empty nose syndrome because of middle turbinate is two type, and empty nose syndrome because of both. And fourth type is empty nose syndrome after turbinate sparing procedure also. It's because maybe because of cautery and coagulation also. And empty nose syndrome of inferior turbinate is the most common type. Main symptom of these type of patient is dyspnea, nasal dryness, nasal burning, nasal obstruction, feeling of suffocation. So these are the classical presentation of these type of the patient, and patient may have some symptom of depression also because of this nasal blockage. And this is the recent advanced treatment. I am giving platelet rich plasma in multiple site of the nasal cavity so that it acts a plasma expander as well as the stem cell stem cell therapy. And this plasma also having various type of the growth factor like insulin like growth factor, vascular endothelial growth factor. So these many type of growth factor are also there. So this efficacy of this treatment is about 70%. And what are the other modality of treatment is you can reconstitute the nasal anatomical structure that allow the nasal airway resistance. You can uh, make the inferior turbinate by flap technique, and you can recover the nasal mucosa. You can transposition from different side to the inferior turbinate sides. So these type of the various method is also available. In all these method there is you have to transfer the mucosa from one side to another. So if you're transferring from one side it may lead to other side problem. So better to try this treatment. And this treatment plasma rich platelet is also useful in anosmia cases where your medical treatment with the steroid is also fail. You can give this plasma rich platelet at the site of cubriform plate in the olfactory area. There are some reports suggested that there will be regrowth of nerve fibers, so there is chances of recovery of the anosmia. Your smell recovery is there by this platelet-rich plasma treatment. The diagnosis of this is mainly endoscopic plus symptomatology. You can ask it's not 25 questions. What what I feel it is clinical and endoscopic more than that any other CT or other diagnosis. So with clinical history you can ask this. There is definitely will be history of terminate resection will be there. As you know, stem cell based therapy belonging to advanced therapy medical product and innovative treatment strategy that could give chance of the disease to recover and regenerate damaged cells and replace them. So this treatment is for the empty nose syndrome and infiltration of platelet plasma in this case. So this is all about empty nose syndrome. Thank you so much.